Ladies and gentlemen, my name is Dr. Eamon Thornton, and I would like to welcome you here today to the International Symposium on Excellence in Maternal Healthcare. We have a very full agenda for the day. However, prior to commencing, I would like to draw your attention to a few announcements. Firstly, CME accreditation forms will be available after the last speaker. We're very pleased to announce that the symposium has been awarded 6 CME credits by the RCPI. If you need to avail of one of these forms, please let one of the staff know. Also, certificates of attendance are also available for those who require them. And as you may see from your revised schedule, the morning session will conclude with an opportunity to put questions to the speakers. And a panel of speakers will also take questions in the late afternoon. And since we have a very full day, can I please ask that you keep your questions succinct and relevant to the presentations you have heard. So please don't be offended if we need to cut you short. We would also like to welcome members of the press, particularly those representing the medical newspapers. There is a section of the hall reserved for the press. If you could please take a seat there. If you wish to talk to one of the speakers, please approach anyone wearing a staff badge. And at this point, I would like to draw your attention to the fire exits, one of which is located behind me here, and one at that end of the room. I'd also like to inform you that all of the presentations are being recorded and will be available on YouTube next week. So without further delay, I would like to introduce our first speaker of the day, the chairman of the committee responsible for organising this symposium, Professor Eamon O'Dwyer. Professor O'Dwyer is one of Ireland's most distinguished medical professionals and was Professor of Gynecology and Obstetrics at NUI Galway for 35 years. A graduate of University College Dublin, he received his training in obstetrics and gynecology at the National Maternity Hospital Dublin and in London, Liverpool and Manchester, returning as Assistant Master to the National Maternity Hospital, where he worked as a consultant in obstetrics and gynecology before taking up his appointment in Galway. A Fellow of the Royal Society of Medicine, London, and a member of the Gynecological Visiting Society of Great Britain and Ireland, as well as the Italian Gynecological Society, he served as chairman of the Institute of Obstetricians and Gynecologists, chairman of the National Council for Postgraduate Medical and Dental Training, and a member of the EEC Committee charged with harmonising medical training in the European Economic Community. He has been a visiting professor to universities in Canada, the United States and Australia, and has acted as WHO advisor in obstetrics and gynecology to the governments of Norway and Poland. In addition, he was an inspector of medical schools in Libya on behalf of the Medical Council, of which he was a member, and in Iraq on behalf of the Irish Department of Health. We are enormously grateful to Professor O'Dwyer for taking the initiative to organise this symposium. Please give a warm welcome to our chairman, Professor Eamon O'Dwyer.
Good morning, everybody. You shouldn't believe half of what you're told. My dear colleagues, fellow medical practitioners and friends, I'm delighted to welcome you here today to the International Symposium on Excellence in Maternal Healthcare. I would like particularly to extend a very special welcome to our guests from overseas and trust that everyone attending will enjoy the conference and benefit from the superb presentations which will be made. As medical practitioners, we strive to provide best practice care to all women who may experience difficulties in their pregnancies. We wish to further develop the expanding practice of treating illness during pregnancy to allow for a healthy and happy gestational period for both mother and baby. It is our hope that this event will give you unique insight into some of the issues surrounding maternal health care, particularly in relation to the management of high-risk pregnancies, cancer in pregnancy, premature birth, mental health, and maternal mortality. I think we can be proud that Ireland has achieved an excellent record in maternal health care. During my 35 years as Professor of Gynecology and Obstetrics at University College Galway and Director of the Hospital Department of Obstetrics and Gynecology there, I delivered with these hands over 9,000 children in Galway. On a television program a few years ago, the counsel on my side was introducing me to the judge, and he said, Professor O'Dwyer in Galway has been responsible for over 9,000 children. And I said, oh, counsel, hold it. I'm not a Superman. Anyway, from my experience, I believe I'm entitled to say that there are no circumstances where the life of the mother may only be saved through the deliberate, intentional destruction of her unborn child in the womb. At the same time, I fully support the statement from the Medical Council, of which I was a founding member, which said that to withhold necessary treatment from a woman because of pregnancy is unethical, as well as being professional misconduct, even though such treatment might lead to the death of her unborn child. As I have already stated, Ireland has a proud record where maternal health is concerned. I believe this is due to the dedication of our doctors and midwives, to whom care of the expectant mother is somehow akin to a vocation. We're all here to learn, and I hope that those of us still in the front line will leave the symposium with increased knowledge and a new determination to make pregnancy and childbirth even more safe in the future. Our first speaker today is Dr. Monique Giraud, who is Assistant Professor in the Division of Clinical and Epidemiological Research in the Department of Obstetrics and Gynecology at Duke University Medical Center in Durham, North Carolina. She is also a staff gynecologist at the Durham Veterans Administration Medical Center and is a graduate of Harvard University and Brown Medical School. Her research interests are focused on the management of high-risk pregnancies and include the molecular biology of adverse pregnancy outcomes, epidemiology of adverse pregnancy outcomes, racial disparities in women's health, and health service research, outcomes and quality in women's health. Dr. Giraud and colleagues recently co-authored research on preeclampsia and stroke risks during and after pregnancy, and has proposed a multidisciplinary, community-based internatal care model focusing on postpartum and preconception prevention and treatment to improve maternal child health and interrupt the cycle of events leading to maternal and infant complications in pregnancy. She will discuss contemporary management of high-risk pregnancies, focusing on maternal, fetal, and neonatal risks. Please join me in giving a very warm welcome to Dr. Monique Giraud.